think that we need to move to the third speaker now, Dr. Estelle Moreau on my right, who is a renowned obstetric anesthesiologist working in the southeast of France. She has been asked to talk about a difficult topic. In other words, how to should one announce the occurrence of a severe complication to a woman or to a relative. We will anticipate that it is certainly a difficult topic, but we are sure you're going to give us a good advice.
Thank you, Dan. Thank you very much for asking me to give this talk today about breaking bad news in obstetric anesthesia. It's an uncommon situation that anesthesiologists have to go and deliver some bad news in maternity setting. Perhaps obstetricians are more used to doing that because during their practice they have to face fetal loss, fetal abnormalities, or something bad during the pregnancy. So, as anesthesiologists, we are more familiar with technical tasks, with management when a complication like PPH or amniotic fluid embolism occur. We are more in the management than in non-technical tasks. It's a stressful situation, we have little time to think, and it's sometimes difficult to find the good word at the good time. But our behavior will have a profound influence upon the patient and her family. Our behavior could impact positively or negatively the patient. Good communication might limit for the patient post-traumatic stress disorder, postpartum depression. We know that both can last for several months, several years. It can be very debilitating. Some women avoid pregnancy, develop a fear of pregnancy because of such a traumatism. For caregivers, such cases are really stressful, and it's not without risk of medical legal issues. We now know that when the caregiver is honest and communicates well with the patient, the risk of lawsuits are less. There is a framework developed in the 20s to help doctors to deliver bad news. It's named SPIKE protocol. It's a 6-step protocol where S for SPIKE is setting up the meeting, try to find some privacy with no interruption. P for perception, patient perception. Try to understand how much the patient already knows about the complication. E for invitation, I for invitation, how much the patient wants to know about the complication. K for knowledge, you give some information, some explanation without medical jargon. Empathy, give time to the patient to express himself, herself for the woman. And S, summary, strategy, explain the following steps, try to involve the patient in the care. But the SPIKE protocol was designed in oncology setting. There is no specific algorithm or protocol for maternity or emergency. Let's have a look at some specificities in maternity setting. We have multiple specialists involved in the care. We need a team coordination. It's really important to have a joint meeting, a huddle, before going and talk to a patient, to a family. We need to agree on the factual information both specialists will deliver to the patient or the family, and it's important to show respect between both specialists, obstetrician and anesthesiologist. In this specific emergent situation, keep in mind the role of nonverbal skills or nonverbal communication, like calm voice, eye contact, touching the patient if appropriate. To focus on the importance of the following visit, I just mentioned a patient declaration in one published in the New York Times, it was. And the patient said, "It still would have meant so much to me for the anesthesiologist to stop by my room, explain what had happened, answer any questions, and find out from me whether or not I was okay." This following visit is a cornerstone in the communication after a critical event. We have to go and to see the patient. We don't do that really frequently, do we? It's really important. Post-anesthesia communication will focus on patient experience, patient questions. Don't hesitate to apologize in case of malpractice. Don't hesitate to thank the patient for her calm, her patience during the critical event. It's simple, it's quite rapid, and it's costless. Thank you.
Thank you, Estelle, for this talk. Difficult communication at that time, very highly emotional moment, I suppose. Maybe one question from the web audience about could you summarize or tell us if you can tell us if there is a good method that you should use to declare, to announce to a woman that she's having a complication, or maybe inversely, what we should not say?
Yes. Yes, I think it's a really important topic because it's sometimes difficult to find the right word at the right moment, and having some sentences in mind can help. For instance, I think that telling the patient everything fine, it's all right, it's not a good way. It's not a good way to make her trust the team, because she feel inside herself, she feels that she's weak, she's bleeding, she has an hypotension, so she feels not okay, she feels not that everything is okay. So don't tell the patient everything fine, everything is okay. Everything is under control, perhaps, but not okay for the patient. I think you can explain very clearly. You are having a complication named PPH. Have you ever heard of it? Do you know what a PPH is? Explain. And after you explain that, you are all the team, and the team will work together. That's why there is a lot of people doing a lot of things in the same time. And ask her if she has some wills. Do you want me to go and to speak with your husband to explain what happened right now? And perhaps you can let her know that she lost some blood, so perhaps she will need some blood from the blood bank. If she's okay with that, and try to explain the further step of the management and let her time to ask questions. I think it could be a good way.
You're right. And what about the relative, the husband, for example, or the family? Is there any difference in the communication management? What do you think about that?
Yes, sometimes we have to go and to speak with the family because the childbirth the patient did not deliver as expected, and there is something wrong happening, and we have to go and to speak with the family. I think we are a team. There is obstetrician, there is anesthetist, physiologist, and the best way is to go together. Before that, we need to have a huddle to be on the same level of knowledge. What do we know about the complication at that step? What do we want to do with the patient? Where will she refer to after the complication? When everyone is okay, we go and we speak to the family. Sometimes, because of the ongoing care, we cannot go together to see the family. But one will go, and in the name of the other, will speak to the family. But I think the patient and the family will need a following visit just to meet the people who were there at that time. It's really important for the patient, but for the family too.
Thank you, Estelle.